So, good afternoon, everyone. Good afternoon to you, ma'am. So, this afternoon, I'll be discussing about birth control and methods. So, I'll be giving only 10 couples of methods, 6 of which are natural methods, and 4 artificial methods. So, first, what is birth control? So, birth control is any method used or done to prevent pregnancy, especially for those couples who have their family planning. So it can be done naturally or artificially. So the first method includes the male condom. It blocks the sperm from entering the woman's body, which protects against pregnancy and some cases of sexually transmitted diseases. And disadvantages includes effective only if used correctly. So if um, misuse, expect the failure. And also, it cannot be reused, of course. Advantages is that it is widely available and it protects against sexually transmitted diseases and is inexpensive, so barato ra siya. Next is the female condom. It is a thin plastic pouch that lines the vagina. The woman can put it in place up to 8 hours before the sexual intercourse happens. But it does not work as well as the male condom. Advantage is that it is widely available and it protects against sexually transmitted diseases just like the male condom. Disadvantage is that it can be noisy during sexual intercourse and you still have chances of getting pregnant. It is not reusable, of course, and it should not be used along with the male condom to avoid breakage and failure of the method. Third one is the IUD, which stands for intrauterine device. It is placed inside a woman's uterus. There are two types of intrauterine device. It is a non-hormonal copper IUD and a hormonal IUD. Non-hormonal copper IUD works for as long as 10 years, while the hormonal IUDs must be replaced after 3 to 5 years. But both types makes it harder for sperm to fertilize with the egg. Advantage is that it is long-lasting, low maintenance, and hormonal IUDs can make your periods shorter and lighter. Disadvantages is that irregular or heavier periods, especially when you are using non-hormonal copper IUDs. Copper IUDs also can make your periods more painful. IUDs is more expensive, may slip out, pwede siya matandog-tandog during sexual intercourse, and may cause side effects. The fourth one is the tubal ligation. It is a permanent type of birth control method. It means having your tubes tied up, but when you undergone surgery, you have two options, whether imo lang siyang pahigtan, tied, or imong ipaputol gyud siya. So a surgeon closes off or cuts off the fallopian tubes. It prevents the ovary or it prevents the egg from leaving the ovaries. Advantages includes it is permanent, it is 100% effective. While, on the other hand, it requires surgery, of course, and may not be reversible, depends on your option preferred. It is expensive and it doesn't protect you against STDs. The fifth one is the vasectomy. So I was enlightened because before I believe vasectomy is the removal of testicles or the testes, but it is not. So other than condoms, it is the only birth control for men. The doctor surgically closes or cuts the vas deferens tube that carries the sperm from the testicle. So it prevents the release of sperm, but it does not affect the man's ejaculation. So, disadvantage is that it requires surgery and may not be reversible. Depende lang gyapon sa imong gipili nga operation. So, Advantages is that it is permanent, just like the tubal ligation, and it is 100% effective. Next is a withdrawal. The pulling out is the age-old method that relies on the man withdrawing his penis from the vagina before ejaculation. So it needs timing for the man. Advantages is that it is free, of course, because you have to do it yourself, and there's no need for devices or hormones or prescriptions from the doctors or health workers. And disadvantage niya is that it is maybe hard to do correctly because sometimes lisod mag-timing, sabi nila. Number 7, the first artificial method, the birth control pill, is the most common type that uses estrogen and progestin to prevent ovulation, and it is very effective if taken right. So if you are forgetful, so taking pills is not suitable for you. Of course, prescription is needed. Advantage is that it is lighter, more regular periods, and no periods, even no periods. There is less cramping during periods. Disadvantage is that it is costly since you have to take it monthly. It can also cause breast tenderness, spotting, blood clots, and raise blood pressure. And upon taking this, you have to also consider your health situation. Number 8, or the second artificial birth control method, is the birth control shot, also called as the Depo-Provera or the Depo. It is a hormonal shot that protects against pregnancy for 3 months. Advantage is that you have to only inject 4 times per year, and it is highly effective. Disadvantage is that it is costly and may cause spotting and any side effects. The third one, the birth control patch. Wear it on your skin and change it once a week for 3 weeks, then go a week without it. It releases the same hormones in pills and works just as well. And advantage is that it is lighter, more regular periods with less cramping. Disadvantage is that it is costly, of course, and may cause skin irritation or other side effects similar to what the pills can give off. The last one is the spermicide, a foam, jelly, cream, or film that goes into the vagina before sex that contains chemical that kills the sperm. And if used often, it can irritate the vagina, making infections and development of STD. So disadvantage it is you are highly at risk of sexually transmitted diseases since it can infect the vagina, but it is easy to use and is inexpensive. So I guess that would be all. I hope I was able to provide the basic knowledge on birth control, and hope also you find it helpful. Thank you for watching.